Thank you for joining us for this episode. Today, I'm joined by Cory Pinegar, and we're going to be speaking about virtual staff in your optometry practice on the OI Show. Hey friends, this is Dave Kading. Before we get into the show, I wanted to thank Team for supporting the podcast. If you're not aware, Team is a virtual staffing and agency which helps connect virtual teams to your practice. I don't know about you, but I have a harder and harder time finding people to come in and join me in the in-office staff. And so over the last 2 years, we've found 10 virtual people to become part of our team. They do things like answer the phone, they help with billing insurance, they check for documentation before it comes in, they scribe in the exam room, they can order contact lenses, and the list goes on. We've been able to work with several agencies over the years, but we have found that Team has been the most effective at ensuring that our virtual employees get paid, stay on time, and that we're following up with them and making sure that they're a great agency for these people. If you are ever interested in considering a virtual employee into your office, I'd love to chat with you. But also, I wanted to let you know that Team is offering a $250 discount when you first sign up with them. Check out hireteam.com, HIRETEEM.com for a $250 discount, or see the show notes below for a link that will get you to the website. Thanks to Team for supporting the OI show, and thanks to you for being a listener. Thanks again for joining us. I am excited to have my friend of probably, what are we, about 6, 8 months here, buddy, Cory Pinegar on, and Cory is with Team. Some of you may have worked with Cory in the past. He used to be with Weave years ago, but it's awesome to have you on, man. Tell us a little bit about you. Where do you live? And some of your history in eye care. You've done stuff in the eye care dental space for a long time. So give us a little history.
Yeah. Well, first of all, it's an absolute pleasure to be here today. This is a very fun part of my job. So I'm just grateful for the opportunity. I'm Cory Pinegar. I'm probably terrible at the self-explanation part of this. Currently live in Salt Lake City, Utah, born in the East Coast of the United States to a large like entrepreneurial but more corporate father. I definitely got the entrepreneurial genes where he got the corporate America genes, and grew up with an itch to always build a business. Was a really early employee at Weave, which was a hell of a time, even though the phones didn't work half of the time. And in December of 2016, I got the opportunity of a lifetime where the co-founders of Weave, Brandon and Jared Rodman, approached me and my business partner, Casey Henson, and said, "Hey, we've got this small department called Recall Solutions at Weave. We're currently, going to lay off about 40% of the company, and this department just needs to go. And, it's doing $250,000 of business at the time. It's probably profitable if you shook the tree enough. And we just need to get rid of it. So if you guys are interested, we will sell it to you for $1."
Wow.
And I, at the time, was going to BYU studying economics to be like my father someday, and had a job offer to go into investment banking in corporate America. And I called my dad, and I deeply love and respect my dad. He's the person I look up to most in the planet Earth. And I was like, "Dad, listen to this awesome opportunity. I can buy part of Weave for $1." And I told them what the business does. And there's silence on the other end of the line. And he goes, "This is the dumbest idea I have ever heard of." And since December of 2016, I've been working to prove him wrong.
So there's been iterations, obviously, of this, and I think you had told me that during COVID, the business had to completely change. So what was happening before, and then what has taken it virtual?
Yeah, this is an awesome question. So the business that we bought from Weave is not Team today, to be clear. I own another company called
Right.
Reach. And it started out purely focused for dental practices. It's still focused for dentists today, and had three main services: insurance verification, call answering, which both have great relevancy for optometry, and then overdue hygiene recare calls is the bread and butter of where it started.
Mm-hmm.
And during COVID, we had a ginormous office in Lehigh, very close to where Weave's corporate headquarters was, and hundreds of team members. And as we all know on this call, getting staff members to stick became increasingly hard. Wages went through the roof. We, I think, during that time increased our wages over 50% in an 18-month period, and
Wow.
everyone wanted to work from home.
Yeah.
And so we were sitting in an executive meeting every day or once a week. And, for us to stay even as a business back then, we were hiring 15 to 25 people every month to train them for our call center to keep the same number of staff. That's how high our turnover was during COVID.
Yeah.
And you can't deliver quality to your customers when your staff is turning over quicker than you can even get new people in.
Yep.
So we were talking about how do we solve the problem, but also at the same time, we can't go post a job for $35 an hour because we couldn't pass those enormous costs along to our customers. So someone came up with the idea that, hey, I've heard there's a program through Brigham Young University called BYU Pathways, and that there's people in Latin America who have been educated at BYU, speak fluent English, are integrated generally into American cultural ways. And the idea was, hey, let's go hire a small batch of them or a small team, and let's integrate them into one of our next hiring classes, and let's prove that this would be lower cost, but more importantly, do these team members stick around for years to come? And I'll be candid that I was the biggest hater of the idea in the room. I think all of us have had those experiences calling Bank of America or Wells Fargo or whoever it may be, where you go to another part of the globe, there's a very thick accent, and there's someone reading a script who can't help you during your moment of need. And because of those experiences, I had developed a very negative taste to hiring virtual or international team members. But we also had no solution within the United States at the time. So begrudgingly, I said, let's go hire two of them, and let's see where it takes us. And over 2.5 years later, I can look back and say it's the best damn decision we ever made. Those are some of the hardest working, and those two original hires that we made at Reach are still with us today.
Yeah.
They're some of the hardest working, most humble people. The customer satisfaction scores on them, even compared to our US team, is actually higher because this is a career. This is not a job to them.
Right.
And that was really my welcoming into the world of talented international work.
And what I love about this story is you were not going outside the United States in an effort to save money. You were going outside the United States in an effort to find people who maybe would stay longer because you were losing at such a high rate. Your turnover, as I think we've all seen, was happening during that time period. And, not to spill the beans, but I've been, hiring virtual people for a long time. And that has been a huge component of it, is that we have a hard time finding an applicant pool for in-office people, and they're not necessarily staying for a long period of time. If we get people to stay for 2 years, that's huge, right? We've got a handful of people that have been with us for 5 or 6 years, but by and large, we're turning over those people. And some of them are going to optometry school, they're going out to do it. But to your point, it's not a career for them, where you're pointing out that these people who you're hiring from Latin America, this is it for them. This is like a major career path for them. Do you have any idea how many people at Reach you have that are now virtual?
The vast majority of our staff.
Wow.
Besides senior project manager level roles and above, we solely hire internationally. We
Yeah.
never let go of our US staff, just as there was natural attrition or natural growth to the business in those frontline positions.
Yeah.
Continue to hire. And I mean, even our finance department, today is entirely international.
Mm-hmm.
Our IT department's entirely international. So it's just not the call center or scheduling or insurance verification roles. But there's certain roles that we found people with immense skill and dedication that we couldn't even find in the US,
Yeah.
and have
Yeah.
built out our teams around that.
So you've got a company that has been utilizing a virtual team to operate on anything that can be done virtually. And then you had this idea, hey, I wonder if we can share this with offices. And this is how you came to team, I presume?
It actually started, it was December of 21, so 2 years ago on the dot. I had a friend who was working in the medical space call me, and she had just won a contract with the US government to read COVID tests as you went into remote facilities. So there was certain secure facilities that the US and large corporations had, where basically you had to take a live COVID test, a proctored COVID test,
Oh,
and then
sure.
they would open the doors to the facility. And she had just won a large agreement, and she's like, hey, could you, with your US call center, hire 20 or 30 people that would just sit on camera all day long, and as people approached facilities, buzz them in? And I was like, to be honest, we don't even hire in the United States anymore, and this is what we currently do. And that was our first agreement. So it wasn't even
Hmm.
in optometry to start. It was just, hey, there's businesses all across the world who need people.
Yeah.
And as you know, people asked certain questions, I said, hey, I can help you find people here. And that was our first couple hundred hires.
Hmm.
Now, the interesting part about that is we had great growth, multi-million-dollar growth within our first year, but it was so sporadic. Our growth was based on my phone ringing and someone asking us a question, or asking me a question, or a referral. So as we began to look at, okay, this is not just a random side hustle that it started as, it's something legitimate. We looked at certain verticals that we felt there was a lack of competition or a viable solution in, and that we had good relationships where we could go to market. So Peter Thiel, who started PayPal, who I think is a brilliant mind, says you want to pick a niche and you want to monopolize it. And so we started to look statistically at areas where we felt we could deliver the most value to our clients that we get to work with. And optometry was our bet, and it's been so damn worth it.
Yeah. Yeah. So let's talk a little bit about where virtual people can fit in an optometry clinic. Um, when you're hiring people, because it sounds like you've been doing this in the optometry space, are hiring dozens and dozens of new people every single month, incorporating them into practices. What are some of the entry level, meaning when an optometrist comes to you, they're like, hey, let's try this out? Because that's the fear, right? Is like, is this going to work for me? Where do people usually start when they're coming to team and saying, hey, I want to try this out?
So there's four general areas that people generally come to us asking. It is inbound phone calls. So that's new and existing patients. I can't, I don't have the staff to pick up all my phone calls. The reason this one's so common is about 29% of all phone calls that are going to optometry practices right now during business hours are going unanswered. Number two, it's outbound phone calls. It's the confirmation calls. It's the overdue patient phone calls. It's all of the mundane work that sometimes gets left behind and then ruins the schedule 48 hours in advance because the confirmation calls weren't done,
Mm-hmm.
or the holes in the schedule were not filled. Number three is insurance verification or light or early stage revenue cycle management work. But as we all know, checking online portals or calling insurance companies when we need to is so mundane, but so vital to
Yeah.
having proper, successful billing and proper patient care. That would be number three. And then number four, which is unique to optometry, is virtual scribing.
Yeah. Yeah. So, Cory, if somebody is like, this is a crazy idea, I don't know if my phone system would work to do that. you know, you've dealt with it all. Like how let's talk technology for a second. How does that work, right? How do I get somebody who's in Brazil to pick up my phone and answer it when it rings in my office? How, like that just seems crazy. And that's just logistically in people's minds. They're like, well, I don't know how to do that, so I wouldn't even be able to do it.
Part of the value that we bring here, Dave, is that we help people with these setups. So we'll work in conjunction with your IT company. It's a whole new world, just like it was
Yeah.
a whole new world for me 2.5 years ago.
Yeah.
And so it's about how do we guide and mentor through that process. If you have a VoIP phone company, you'll be able to virtually set up team members where they'll work off your system. If you have a landline or older, maybe Comcast or Spectrum, we can help set up a virtual solution to work there. It's still yours at the end of the day, but our guidance part of the process and the reason we have an account manager who works with you is so that as you have those questions or have those obstacles, we've watched hundreds of practices do it really successfully and
Hmm.
some not successfully. So how do we guide and mentor through those times to make it as seamless as a successful setup as possible?
Yeah. So I'll speak to that because when I started working with Team, and I'll just in full disclosure, I am a customer of Team. I have already worked with several other companies before coming to Team. And so, granted, some of these things were already worked out when I came to be with you because I had to figure them out. But when we first started working with virtual people, I remember my office lead was spending she probably put in about 40 hours figuring out how do I get these people that Dr. Dave told me I have to hire to answer the phone. Like I got to figure that out. And she spent hours and hours figuring out this technology. And the company that had hired these virtual people for us was kind of just there and being like, well, let us know when you want them to pick up the phone, right? And that is a huge obstacle. And not everybody's going to go through what my office lead did because not everybody's a slave driver like I am. Like, get these people answering the phone, right? So when we came to you, some of that had been figured out. It's still a little bit clunky. You've helped us with that, but so you said that you're hiring people, but also you've got an account manager. Let's start with that. Like, let's start maybe back up a little bit. Somebody comes to you and they're like, "Hey, we want to hire a virtual person." Walk me through the conversation you're going to have with me as an office start to finish where that person is starting to answer the phone or scribe for me. What is that week? Is it a week? Is it 3 weeks? Is it a month? What does this process look like, Cory?
So before we even start, when someone comes to us to hire a additional team member, that we want to go to the core, not, hey, why do you need to hire? What's the problems that you're facing within your business?
Hmm.
And we want to make sure that a virtual team member could come in and fulfill that need well. We don't want to put these hardworking individuals who are in a practice in a situation where we know there's a high chance of implosion.
Hmm.
So it's much more of a consultative process to us because there's real humans on every side involved here. This is not a software we can stick in and take out in 30
Yeah.
days.
So I have to just interrupt you. What I love about this is in working with you, you really, really value these people that you hire for me, right? You and I have talked about this at how other companies that I've worked with for those companies it's just a paycheck for them and then they find somebody to fill in. But you're kind of wanting to protect these employees that are in these other countries and make sure they're taken care of so that they stick with you for a year or two or three. And so that's an important part is like, let's make sure we find out who the right person is and do you really need somebody? That's a key component.
And I'll share this is a total deviation from our subject, but something that as an entrepreneur or a business person, I'm really passionate about is something called shareholder capitalism. And what that means is there's three parties who have to win for a business to be sustainable in the long term. And that means the business needs to be profitable. Number one. Number two, it means it needs to have happy and retained customers. And number three, it needs to have happy and retained employees. And unless all three of those are done in a generally equally yoked manner, the business, in my opinion, is not sustainable in the long term. And so
Right.
we're not just running a charity case. Like, we deeply value our team members, but at the same time, if our team members don't feel healthily paid, paid on time, respected as a co-equal to anyone in the world, then they eventually run out on the job. And that means you get lower performance as part of your company. And that means they attrit at higher rates. And so we want people where we pay damn well, and that we treat them like human beings, and we listen to their concerns, and we continue to evolve, because that means we have people knocking on our door to work with us. And we can, something we talk about internally all the time is, we want to be the hiring, or the Harvard of hiring, where Harvard every year gets to be so picky that there's probably 3 or 5%. I don't actually know the real number on the number of applicants. It's not the, McDonald's where you're pulling through and they're like, text 33555 and start your job for $18.50 today. And so if we create a demand instead of a begging atmosphere, where they come in and they know that they're not only getting good pay, but they're being developed, I believe we deliver the best work and we create the
Yeah.
most sustainable company. A total side rant, but I've been in business. I've done this for almost 8 years now, and I've been misguided or lopsided at certain times where the businesses as I were running lost money. And guess what? You can't continue to run them if they lose
No.
money, or you didn't value your employees, or your customer solution wasn't what it should have been. And those are the worst situations to be in.
Yeah. So you've told me this before, but you're hiring people in the top percentage of wherever they live, right? Is that top 30% or something? Like, what is it usually from a pay perspective that they maybe, are you just paying them bottom dollar, or do you guys, you've told me that before.
So just as an example, in Brazil, our base wage, like our minimum wage, puts you in the top 20% of earners.
Wow.
And so, every country, that number slightly varies, but it's how do we hire that, top 10, 15, 25%, where we can
Right.
hire someone very capable, where this, we truly know can be a career, and not just asking them to make a career commitment.
Yeah. And so if they're doing something above and beyond and they've been trained a while and they get paid a little bit more, they're even in the higher percentage than the top 20%. Okay. Sorry. I got you off on a rant. That was my fault on that. Go back to how do we get this person in? You've interviewed the office, made sure they're a good fit for having a virtual person, and you figured out what they need.
So once we sign an agreement to move forward, whether it's 1, 2, 3, whatever the number of hires is, and I would say I recommend a practice starting with 1, because it's a learning process during
I
that.
disagree with you.
Oh, you're 2 at the same time.
I never will hire one, and I never recommend anybody hire one. I know that conservatively, that's smart of you to say that. I always recommend you hire at least two. And the reason why is the greatest burden on an office in the hiring process is the training. And if you're scared that this is going to not work out for you, find enough things that two people can do, hire two of them. Worst case scenario, one doesn't work out. We haven't had that issue with team. We've had it with other virtual people, the other virtual places we've worked with, but it didn't work out. And then we hired somebody, we trained them for 2 months, and then it didn't work out. So I always like to hire two. And then if somebody doesn't work out, or we end up hiring another person, then one of those two people is now the trainer of the next one. And so my recommendation is different than yours, Cory. Yours is a good one as the owner of the business. It obviously shows you're conservative in it, but is to always hire two.
Hey, and you're the one who actually hires and trains them. So I'm going to go off your opinion here. From there, we tee them up with the account manager. We get really nitty gritty on, do we want them to be bilingual in English and Spanish? What hours do we want them working? What skill sets do we want them to come? Because someone who's really good at answering new patient phone calls is not your best insurance verifier. Those are two different personalities and skill strengths, once we know what the goal is, what we're solving for here, what personality we're looking for, then we go recruit. What we don't want to do is say, oh, Dr. Dave, you need a virtual assistant. Let me bring out of our showroom here 3 people who could possibly be good. But the problem with that is you're throwing mud on the wall.
Mm-hmm.
So then we go through that interview process. That interview process generally is 5 business days after your kickoff call. If one of those 3 to 5 candidates are good for the hiring manager, the owner of the business, then we begin the process and get them hired to start day 1 for the company.
Yeah. Yeah, and so really from an initial phone call, it could be 2 to 4 weeks before that person starts. And I'll say that may be a little longer than other places that I have other virtual places that I've worked with. But the caliber of the 3 or however many applicants that you give me to interview is a lot higher. So I think you guys spend a little bit longer going and looking. Whereas I think with those other companies that I worked with, what they did is they just were like, hey, who wants to be a virtual scribe? Okay, great. Have you ever done? They don't even ask if they've done it before or if they have any experience or if they're willing to learn. It's just they throw them at me, and then I'm like, do I like this person? And really, mostly, do I like their English? Is kind of usually what I'm asking. It ends up with the applicants that we've had with you. They've been a little bit higher caliber, and now we've got a struggle of which ones to hire as opposed to do we want to hire one of these people? So that I think that's a good thing that it takes a little bit longer. Good things come to those who wait, and it's not a long time, but it also helps that onboarding process.
And so it's a very good call out. That's real compared to competitors. We do not bring interviews as quick. A goal for us in 2024 is to begin to speed up that process. What we wanted to do is, number one, quality is something we can't compromise on. Once we can prove that process, how do we begin to shrink the time? Because most people, to be candid, who are coming for us or coming to us are in a current need. And
Yeah.
so I actually very much agree with your sentiment of quality is number 1, and then timeliness is number 2, or speed to action. And that's something we're actually working on. Just a fun
Yeah.
tidbit.
Yeah. So usually my team actually handles this, my in office. I have now designated one of our team members as the manager of our virtual team. And she's kind of in charge of the phone calling, the insurance verification, and the billing. We actually have our virtual team do some of the billing. And so she manages like 5 or 6 people. We've got 10 to 12 virtual people that are working with us at any one time. But recently, I myself wanted a new marketing person. And so I came to you guys, right? So most of people are thinking about team for those 4 things that you mentioned, the inbound, the outbound, the insurance, or the scribing. But you're happy to find people for other things, which is really impressive. So I managed that process. And what I thought was really interesting is you had Nate get a hold of me, and Nate called me up like a half hour after I called you and or emailed you guys and said, hey, I want a marketing person. And he grilled me on questions that I didn't even think about for what this person was going to do. And that was before he even posted the job so that he could go out and find people. And the marketing experience that those applicants had when I interviewed them was pretty impressive. And so I think that goes to having that timeline being a little bit longer, and that's okay. Um, so I think people just need to have a little bit of a patience. I think we're going to see a big explosion in virtual in 2024. I think you're probably ready for that, but you're starting to see this wave starting to happen in the United States, but also within healthcare. Is that something you guys are ready and poised for, or is it are you nervous?
Um, we anticipate it. Number
Yeah.
1, I would say we're already seeing the ground swells of movement, especially within optometry where people are hiring. And number 3 for me is just continuing to replicate and improve our quality as we scale. Because it's one thing to run a individual restaurant and every meal is darn good. as we continue to grow our team and grow our infrastructure, can we do it bigger and better and not just at the same quality? So it's an
Mhm.
exciting time. I mean, as an entrepreneur, these are the gold rushes that you live for, where you've found product market fit and now it's continuing to scale it and make it better.
Yeah. Yeah. I think so too. I guess the next kind of question that people have is how expensive is this? And we don't need to talk direct prices unless you want to, but I'm paying people like, and I'm high in Seattle, but it's difficult for me to hire anybody for less than 18 or $20 an hour. Add on top of that all of my taxes, all of the insurances, and all of those sort of things. Really, most employees are costing me 25 to $30 an hour. Is the arena of the virtual space considerably less, partially less? Like, what are some of the economic aspects for the practice?
Yeah, really good question. So our pricing comes out, we charge a flat monthly fee, whether it's full-time or part-time. Well, depending on whether it's full-time or part-time, that fee fluctuates. But our average hourly comes out to a little over $11. I think it's about $11.50 an
Hmm.
hour. And the nice part about that is it covers the whole kit and caboodle of costs where, payroll tax adds in all of the unemployment taxes and healthcare. So that's where we land for a full-time hired team member. We're $1,850 per month.
Okay. Okay. And so, what kind of hours is that? Like a 20, 30 hour? Is that a full-time,
That's
mostly
full-time.
40 hours a week? Okay.
Yep. And what we look at is 8 full working hours a day. And then for part-time, obviously it's just 925 a month.
Yeah. Cory, I don't know if I could figure out this. I'm asking this question for somebody else. Is Cory, I don't know I can figure out 40 hours worth of work for somebody to do. You got to hear that question all the time,
Mhm.
right? And how do you respond to that? I have my own response, but I was curious what you think.
I mean, I probably will give the conservative response out of our tandem here. That's a great place for people to start part time. I actually think the bigger reason people struggle to find the work is they're afraid to let go. It's different to hand a piece of paper to someone in the office. Now, once you've gained the trust and rapport, then it's like, oh, if I can do this, they can do that. And if they can do that, then can they do this? And it's the snowball effect. And that's why some of our customers start part time and then grow their way into a multi-person relationship. But I'm also very intrigued to hear what you think.
No, I think you're right. I do think that you're right. And I think that it also is one of those things where you need to be looking for opportunities to raise your level of service to patients. One of those could be is you've got a person who got referred to your office or you see a new patient. What an opportunity for you to go in to that new patient's account before they come into the office and call and get the prior records so the doctor can review them. What about reaching out to the patient and saying, hey, we've got this questionnaire. I can fill it out over the phone with you, or I could send it to you over an email. But rather than just getting a text message, if you get that personalized phone call, if you get a phone call after the appointment, hey, would you mind filling out a review? We really enjoyed having you in the office and touching base with them on that. There's marketing opportunities, right? Utilizing artificial intelligence to be able to help with some marketing programs and having somebody who, maybe you're in between patients and you've got an hour, right? That person could go and help write a newsletter for your patients. You could tell them what you want it to say. They could go to artificial intelligence. They could do some editing with Grammarly, Quillbot, whatever it may be, and then send something back to you. You quick read over it. Another thing is that we do not send letters to primary care providers nearly to the degree that we should. Maybe we do it for diabetic patients, but what about other patients who have systemic diseases? So your patient came in, they have diabetes. What a great opportunity for you to have a base letter for you to go in and say to your virtual person, hey, would you mind going and doing that letter, filling, and then you tell them what you want filled in on it. They write the letter for you. You get back from lunch, you've got 3 letters to look over, and boom, then the virtual person either faxes it or emails it to the primary care provider, or can print it off into the office, and somebody in the office can put it in the mail, send it out. So the writing of the letters is a really, really big one that can be done. So there are things that we don't currently do that we should be doing because we don't have time for it. And our current in-office staff, because we're mostly understaffed, is never going to be able to take on those duties. But if it could be done on a computer, it can be done by somebody virtually. And so what is being done in the office that is not on a computer? Well, you do need somebody to walk around the office physically to, do the equipment, to take the retinal photos and whatnot. But once that person gets into the exam room, and once that person has passed that person off to the doctor, then a virtual scribe can get everything entered into the computer, can do all of the coding, can do all of the charting, can do all the letter writing, can do the recap of everything, can send the patient text messages, can order their contact lenses, can call up the contact lens laboratory and order the contact lenses. The list of things is endless of how we can take things to the next level when we have somebody who can partner with us in that.
I
Those are just
love
a
the way
couple
you
of
think.
my.
Well, no, it's very true. Where you're looking at a business from where have we developed holes in our business that we couldn't fill because of the cost of staff before. You eventually have to say when push comes to shove, because doctors have to take home money.
Yeah,
This is not a charity case. This is what the staff can do. But when your cost of labor is 1/3 or 1/2, it's how do we go to the next level, which just makes you a magnet for marketing going forward
yeah,
because patients say this is different.
yeah, yeah. And I just was on an airplane recently, and I'm showing Cory this. This is my list of duties that my virtual team could do or is currently doing, is how do we make this even better? With the billing, insurance credentialing, verification online, communicating over GChat, texting, emailing, phone systems, develop people in office who are really good at training so that they can then further train other staff members as they come in, developing standard operating procedures so that when somebody else comes in, we have a document on how to do things. And I think one of the other key components that I just wanted to talk with you a little bit about, Cory, is how do you make these people that are in another country part of your team, right? I think what I've observed is that offices who don't do well with virtual staff, it's because they see them as a software, right? You've probably dealt with that. How do you see that occurring in offices?
So it's actually even part of our consultative approach. Going back to that, there's certain people who call in and just say, hey, I need 3 people to do some really busy work and they can't take holidays. And what happens if they're sick? Like, do they still work with and very early on, you can tell someone doesn't value them as a human being.
Mm,
And the biggest thing that it takes to be successful in integrating a remote team is just treating someone like a co-equal. They're no
yeah,
different than we are. They are dedicated to the job, and then inviting them and treating them like an in-office team member. When you do your morning huddle, have them join from a Google Meet or a Zoom
yeah,
link. And when you do your office holiday party, have them dress up and have a background. And when it's their birthday, send out a message to the total office. It is the little things, but nothing at the end of the day, none of those bells and whistles changes the feeling that they're a co-equal. Because when you look at Latin America and the Philippines and India, they are so used to a corporation coming in like Deloitte or Accenture and hiring 100,000 people, and for them just to be a number.
mm,
Where they crave to be different is to be a human. And that's what's
yeah,
so exciting for them, not about just the pay that comes with these opportunities, but to work with people and to make an impact, and not just to push paper and to follow policy.
Yeah.
And when people break it down that simple, it goes monumentally far.
Yeah. Yeah, I was sent a picture by one of my virtual managers, and she sent me a picture of the meeting that took place on Halloween, and it had all of the team members wearing their costumes with, weird backgrounds, and they were all dressed up, ready for the day, and they had just developed that they're a team of people. They're not just like these individuals who are checking insurance. And you know, the more you can get the individuals that you're working with virtually to be integrated with the office, the better it will be for the office, and it'll better be for them, just like you bring up. And I think that is a key component. Finding ways that you can bless them, right? Like figuring out when their birthdays are. There's holidays that happen other parts of the world that don't happen here, and if you can find a way to make that holiday important for them. I recently had a team member who was in the Philippines. She had to have brain surgery, right? So how do we help support her? Because she doesn't have health insurance. And how do we find her? But she's been working for me for 10 years. So she's, my friend, and so realizing that these are real people, getting to know them, talking with them about what's happening in their real life, all it takes is like 2 to 5 minutes a day in between patients where you're having conversations, and those things happen organically, just realizing they're not just a number. So, I think in closing, Cory, let's talk a little bit about what differentiates Team from some of the other virtual companies that are out there. You're like the virtual guy, right? You know more about this than maybe anybody out there. But there's something that you had to do to differentiate Team and that from some of the others. So why might it be more beneficial to work with you than some of the other companies that are out there?
Yeah, really good question. Number one, it's the people. And what I mean by that is it's the quality of people that we can find. So we exclusively or predominantly hire out of Latin America. Why that matters is you can get people who are bilingual in Spanish and English, which makes a very big difference with the growing Spanish speaking population within the United States. Number two, the benefit of that is Latin America's the same time zone. So outsourcing is very common in the Philippines and in India and in Pakistan. But the problem is that's the middle of the night. And so it's harder to retain team members if you're working from 11:30 p.m. to 7:30 a.m. every single
True.
day.
Yeah.
Number two, it's our relationship with Brigham Young University, knowing that someone can go through 4 years of coursework as a dedicated individual at a standard that we know. When we see a random university, and I'm not saying anything bad or good, I just don't know the quality. But I
Hmm.
went to BYU myself. It's seen as a top 25 university within the United States. And so we know the quality that's coming out of it when someone graduates. And also, it shows that they're dedicated and engaged, but they're understanding or beginning to understand integration into American culture. We are unique as Americans about time and how we hold our meetings and how we interact with each other. And we're used to that because that's all we see every single day. But when you hire a virtual team from another part of the globe, that's an adjustment phase. And so we found that adjustment phase to be much easier when they've already integrated it into American culture. Number three, and specific to optometry, is this is home for us. It's not just about providing virtual team members, but it's understanding HIPAA compliance, and it's understanding how our account managers can integrate your team member into your virtual soft phone with Weave to make that process more simple. Or when you come and say, hey, Jose is doing 3 insurance verifications an hour, they know that's a standard they should be at or shouldn't be at. And so it allows us to relate and connect better and hold people accountable to higher standards, because we're really working not to be a provider of people, but to be industry experts on how to integrate those people in. and maximize value on both sides.
Mm-hmm. Yeah. Yeah. So true. Well, I think this is a really good opportunity for people. Hopefully, people that are listening get an opportunity to look into how a virtual team of people can help elevate their practice and go to another level. I think the caliber of the people that you're bringing to an interview is spectacular, but I think it's beyond that. It's the account manager, right? And I personally knew my account manager before she joined team, so it's been really cool to see her come on board and help. But she's just looking out to make sure everybody's working well. She sent me several emails after we'd hire somebody and be like, how are they doing? Or there was an issue with some hours that were reported. And so, I don't have to deal with those, like having my team of managers deal with it. Team has been really, really helpful with that. And so I appreciate you coming on and sharing your perspectives. It's been awesome chatting with you, my man.
Hey, I appreciate the time.
Yeah. All right. And thank you for joining us for this episode. Make sure to like and subscribe. Stay tuned for future episodes of the OI Show. Thanks again, friends, for joining us for this episode. Again, thanks to Team for their support of this episode. If you're considering or have ever considered getting a virtual team member for your practice, check out hireteam.com. That's HIRETEEM.com. Mention the OI show when signing up, or hit the link below for a $250 discount off of your first month's team member.